Hi there, I'm Dakota and I work as a CRN or clinical research nurse at ICON. In this video, I'll walk you through what a typical day in my role as a CRN looks like and what you can expect if you join ICON. First thing I do when I get to work is I grab my personal schedule and overview to check what my procedures and roles are for the day. I typically do this to check how much time I have before the start of my first procedure. I don't really have a prioritization for my day. It's usually predetermined by the order and times of my procedures, but I will check to make sure nothing overlaps. Once I've reviewed my daily schedule, I'll prepare for my first procedure, whether that's organizing a medication for dosing, setting up a cart for blood draws, or even prepping subjects for vitals or ECGs. As a CRN, you can typically be tossed into two different roles. The first role would be working on procedures on the floor, such as dosing subjects, drawing blood, gathering vitals, capturing ECGs, or helping with meals or even serving. In this role, you interact with most of the medical team members and MRAs. The second role you may be placed in would be a shift lead. This role resembles that of a charge nurse, where you monitor many of the clinic activities to make sure things are running smoothly. This role focuses on delegating tasks, reworking the schedule if there are call-ins, communicating between medical team members, clinical study managers, and lab technicians, and even preparing for group check-ins. The latter of the two roles tends to provide many more challenges due to the increase in responsibilities. There is a lot of teamwork involved and delegation. Much of the problem solving comes from figuring out who to communicate with and making sure everything is done in a timely manner. Time management is one of the most important skills to have. The most rewarding part of my job is knowing that you're a piece of a bigger puzzle. Our work is vital to medical research and making sure everything is completed to a certain standard. I also find a lot of value in knowing I'm part of a great team that has each other's backs, and I know I can count on my coworkers to pick me up if I'm down. Most of the challenges from this role come in the form of time management or not communicating when you don't know something. Challenges can come in the form of having difficult blood draws or having to repeat vital signs or ECGs, to delegating tasks so you can prepare for a check-in, or even monitoring subjects who are having severe adverse effects. CRNs are incredibly important to the clinic, and we tend to be some of the only ACLS credentialed staff on the floor aside from our medical team members. Clinical research has so many facets to it that it does become difficult to keep track of everything you're supposed to know. That's why I always approach problem solving by being open and communicative. If I can't answer a question or know how to do a certain procedure or process, then I make sure I can find someone who can, and I make sure I learn from that.